everyone, and welcome back to another episode of 5 Minutes in GI. Today, we are so excited to have Dr. Austin Chiang with us. He is not only one of IFFGD's junior academicians, but he is the assistant professor of medicine at Jefferson in Philadelphia, Pennsylvania, and the director of the endoscopic weight loss program. Thank you for taking the time on your busy schedule. All of that stuff, it sounds like you're so busy.
Yeah, well, thank you so much for having me. I really appreciate it.
Of course. So let's just jump right into it. Today is a very exciting topic, especially with the increasing use of technology in the scientific field. And so today we're going to talk about colon polyps and how artificial intelligence, or AI, can transform the detection of colon polyps.
Absolutely. So I think everyone is pretty familiar with, a general sense of what artificial intelligence is, but just to refresh everyone's minds, it's basically a big umbrella term to describe any sort of um, way that a machine can help mimic human decision making. And there are subsets of that, primarily if you hear machine learning, that's one subset of artificial intelligence where um, the machine can basically learn on its own and improve upon itself. And so, what used to be kind of a pie in the sky type of a vision is now a reality because now artificial intelligence can actually help clinicians with their decision making and potentially assist them in helping make better decisions and helping, identify polyps on colonoscopy a little bit better. Um, and the reason why we're finally hearing all this buzz about artificial intelligence, even though it's been around for decades, is because finally we have the computing power that allows us to actually, use these machines in a meaningful way. And so we're already seeing that there are machines that are able to help us, identify polyps during our colonoscopy when we do colonoscopy, because when we're doing colonoscopy, it's hard to be able to see everything. Your eye focuses only on certain areas on the screen, and so machines can help guide you to areas where you might want to take a second look. And studies have shown that there have been significant increases in our quality metrics related to screening colonoscopy, primarily adenoma detection rate, which is often viewed as kind of the primary quality metric when we're looking at whether or not a colonoscopy is good quality or not. Um, and what that translates to is a potential reduction in colorectal cancer incidence. And with that, obviously, quality of life that comes with patients who don't have to, suffer from cancer, cost to the healthcare system with regards to imaging and chemotherapy and surgery and all that comes with, a cancer diagnosis. So, obviously a big part of what we do in gastroenterology is try to detect things early and treat things early. So this can help us do that. And as artificial intelligence becomes more sophisticated, it can also help potentially with, other quality metrics related to colonoscopy, like showing us how much of the colon that we've actually examined, being able to automatically identify certain landmarks, being able to help identify the prep score, and with all this automation, hopefully help us be more efficient in our jobs, help make it a little bit easier for us to do our jobs. So hopefully a lot more to come with that. And I can only imagine, how AI is going to potentially impact the rest of the GI tract, because there's a lot of things that AI can potentially be applied to, and a lot of different tools that AI can potentially be applied to as well. So very exciting all in all. And so it's not something that I think there may be a misconception out there that it's something of the future. It's actually very much of the present. And in fact, I think that we're kind of lagging as a field behind some other fields where there's been AI already for years and years, like in radiology or ophthalmology, where they are kind of not relying on these machines, but working hand in hand with these machines to be able to kind of achieve better patient outcomes.
Exactly. And I think a lot of people are afraid of it. But as you mentioned, there are so many benefits to including it in these areas. And so I'm glad you touched on a lot of those for us today.
Yeah, absolutely. I think, for those people who might feel like a little hesitant about it, that's totally normal and healthy, first of all. But AI is pretty much in our lives already in a lot of things that we do, right? In
Right.
our navigation that we use and in social media algorithms and I think uh, there's just going to be a lot of different ways that it's going to impact healthcare. I think it's already being used in helping scientists better identify like potential drug targets and things like that. So there's so many ways that we'll see AI hopefully, impact healthcare for the better.
Absolutely. And I know you mentioned colorectal cancer. I know that has been blowing up in the news recently.
Yeah.
We've seen way more cases of colorectal cancer now than we have in the past. And so I just want to mention for people out there that colon polyps are growths that form on the lining of the colon or the rectum. And while most tend to be benign, meaning that they're non cancerous and can be harmless, some can develop into cancer over time, and that is why early detection is so crucial. Regular screenings like colonoscopies can really help identify those polyps before they become problematic, and advancements in technology, such as this AI, are making that detection more precise and efficient.
That's right. And so if you are of average risk, meaning you don't have any family history or any other underlying conditions, you have to start getting screened at age 45. And the reason why we prefer colonoscopy is because we're able to actually see where the early growths are and be able to address them on the spot, unlike some of the non-invasive tests, which really are reserved for some people who, may not be able to get a colonoscopy. So either way, make sure you're screened. Like you said, we're seeing growing rates of this, especially in younger people. So just want to make sure everyone's aware.
Yes, absolutely. Thank you so, so much. Now, that is all the time that we have for today. Don't forget to hit that subscribe button. And as always, if you have any questions after watching this video, please email us directly at iffgd@iffgd.org, and we'll do our best to answer your question in another episode of 5 Minutes in GI.